Hey everyone, today's session is called Dehumanizing Care, Privacy, Bias and AI and Health Systems. And we're fortunate to have Patrick Lynn today with us he's a clinical teaching fellow at New York University School of Law, and he co-teaches in the Technology Law and Policy Clinic and the Science, Health, and Information Clinic. So Patrick is a busy man, but Patrick has made time for us. He's also a fellow at NYU's Engelberg Center on Innovation Law and Policy. And Patrick spends a lot of time thinking about technology, clinical care, and the legal implications of all of that. So the talk today is going to focus on how AI is changing the health systems that we all operate. Patrick, over to you.
Great. Thank you, Andrea. And I also want to give a quick shout out to Brittany. Thank you for reaching out and inviting me to be here today. So thank you. But hi, everyone. I'm excited to be here with all of you. And thank you for the introduction, Andrea. Today, I'll be talking about what sort of led to the widespread adoption of AI in healthcare and how that trend has resulted in some often overlooked privacy and bias risks. I'm going to do kind of a quick, 20, 25-minute presentation. I'll leave plenty of time at the end for questions and discussion. That's kind of what I look forward to the most in a lot of these. And so I'll make sure that we get a chance to have those conversations sort of at the tail end of this. And the insights and opinions I'll be sharing today are my own, but they're informed by roughly 10 years of studying, researching, and working on privacy and bias issues in algorithms and AI models. And so, yeah, I'm excited to be here with all of you. Andrea, can I share my screen? Okay,
You should be able to.
let's see. Is that coming up?
It is.
Great. Okay. So our story really starts with data. Data has always played an incredibly important role in healthcare. And medical records and clinicians, the written accounts of patients and their interactions, those have always been a really key part of modern medicine and have been for over 100 years now. But electronic health records really ushered in a sort of tech industry gold rush. EHR, electronic health records, that adoption only became really widespread in the US in the early to mid 2010s, um, and in large part due to one piece of federal legislation, the Health Information Technology for Economics and Clinical Health Act. It's a bit of a mouthful, and it's more commonly known as the HITECH Act. Congress loves their clunky sounding laws, and then turning them into these sort of catchy acronyms. So the HITECH Act was actually first sort of thought about back in 2004. Back then, President Bush announced a 10-year goal for most Americans to have electronic health records. And then in 2009, President Obama signed the HITECH Act into law, offering billions of dollars in incentives for healthcare providers to adopt certified HR systems. Now, the HITECH Act became something of a watershed moment in the healthcare industry. Providers who adopted electronic health records earned really significant Medicaid and Medicare incentives. But on the other hand, those who resisted this adoption actually faced penalties. And so the federal government was really pushing for this adoption. And this piece of legislation didn't just encourage digitization and datafication of healthcare, it practically mandated it. And so, in fact, according to NIH, in 2008, less than 10% of US hospitals used electronic health records. And by 2015, over 80% had adopted the technology. And so this legislation really worked, and sort of Bush's vision way back when in 2004 really came to pass. And now electronic health records are kind of the staple in health systems across the country. Now, why are electronic health records such a big deal, right? When we're talking about AI, I really think of electronic health records as kind of the advent of AI adoption in health systems. Tech companies are in this sort of perpetual pursuit of data, right? Health data is probably the most valuable data available, in part because it remains among the most private and sensitive. Social media companies like Instagram and TikTok, they can extract information from users just from their activities and interactions on the platform. It's actually very easy for social media companies to get a sense of the things we like to do, who our friends are, who our family members are, and what pop culture, things are we following, movies we like, that sort of thing. Similarly, Google can figure us out really easily, and they can influence our behavior just based on our search history. And then Amazon and plenty of other online retailers and e-commerce websites, they can really, really efficiently create a profile of the type of consumer we are based on our purchase history. But health data and medical records have always kind of been quite elusive, and we're always just out of reach for tech companies. But the widespread adoption of EHR really opened the door for big tech to access that data. And we can see signals of this too. Um, Back in 2009, right, when EHR really just started to kind of take off, the first Fitbit was released. And just a few years later, in 2014, Apple launched the Apple Watch. And in 2021, Google acquired Fitbit, and a year later launched their own Google Pixel Watch, line of wearables. And beyond that, Amazon launched Amazon Clinic in 2022, then acquired One Medical, another sort of business that operated their own sort of primary care service clinics in 2023. At that point, actually, when One Medical was acquired, they had something like over 800,000 patients and members using their service. Um, and so what we're seeing here, these are just a few examples of how tech companies have found ways to get a hold of health data. I think it really shows just how precious and valuable health data is to these companies, and the ways that they're looking to use electronic health records now that they've been digitized and made more available, how they've kind of really actively tried to go after it. And with fitness tracking apps and devices, people are just freely handing that information over to corporations that don't necessarily have to comply with HIPAA. And companies like Amazon are either entering the health industry on their own or buying up and acquiring businesses in the industry already. So this raises some really interesting privacy issues. Big tech has kind of successfully recasted medicine as not just the science of care, but as a science of information. All of a sudden, getting really effective care from a hospital or health system was extremely data driven. Healthcare and health data from wearables, that became a real trend as well. Everyone is sort of tracking their steps. Everyone is sort of gauging what their heart rate is when they wake up, that sort of thing. That became really ubiquitous as a result of these wearable devices. But that plays sort of a larger sort of existential role too, right? The patient is no longer viewed as just a human in need of care, but as kind of a collection of data points now.
I think we may need to
Um,
advance the slides, Patrick. I'm just seeing the kind of retina looking thing.
oh yeah, I'll be transitioning over to the next point
Got it.
in a second.
Apologies.
Yeah,
Thanks.
thank you. And so this really the datafication of healthcare removed some of the humanity from that doctor-patient encounter, but also opened up a world of privacy risks. And so we have this sort of garden variety privacy risk, right? With less and less data being exclusively held and managed by hospitals and health systems, and now there's a greater risk of data breaches and leaks, for example. But more alarming is actually how the datafication of healthcare has brought so many more institutions and vendors into the mix. So sensitive patient data is now transferred between health IT systems, electronic health record vendors, patient portals, digital medical devices, and so on and so forth. This really starts to test the limits of the Health Insurance Portability and Accountability Act, HIPAA. Um, HIPAA's special provisions grant data access to researchers authorized by the institutional review boards and a very select few third-party vendors through data use agreements. Usually, those businesses had to be very sort of essential to the provision of healthcare. Later changes to the privacy rules in HIPAA also gave patients full and immediate access to all of their medical records as well. But again, right, with electronic health records, what we're seeing is Amazon, Microsoft, and Google, they've created their own certified cloud services. And those became actually HIPAA compliant in the early 2010s. And so now all of this health data that hospitals are managing and getting access to, rather than being stored in, filing cabinets or, in maybe some sort of filing room in the basement somewhere, they're now being sent off to the cloud in servers typically held in the Midwest that are being managed and held securely by these companies. But by offering these services to hospitals and health systems, tech companies were essentially able to gain access to the health data through contracts, right? With those same data use agreements that researchers and electronic health record vendors, right? These institutions are really kind of essential parts of healthcare provision. Now, hospitals and healthcare systems are using contracts to also grant access to that data to these for-profit corporations as well. Now, enabled by data use agreements, big tech is now offering, quote unquote, solutions, not just for back office functions, like IT, but also point of care activities, right? We have ambient scribes that are now recording conversations between clinician and patient. Um, and also even clinical decision making oftentimes can be outsourced to an AI system to provide recommendations for a diagnostic or next steps in treatment. An example of this, there are quite a few here, but something that comes to mind for me is back in 2023 with the Amazon Clinic. That was rolled out in 2023. And in order for Amazon customers to use this service that Amazon was offering, which allowed them to chat with a healthcare professional, refill prescriptions, things like that, Amazon actually required on it by default users to essentially authorize Amazon to gain access to health and medical records, and didn't necessarily waive HIPAA protections, but authorized Amazon to access what would have been HIPAA sort of covered information without Amazon Clinic itself being HIPAA compliant. Um, and so what we're seeing is HIPAA, this law that we often point to as sort of, the main protector of patient privacy. It's becoming increasingly obsolete, I think, as health systems become more and more reliant on third-party vendors owned by tech companies. Data use agreements now allow companies to directly gain access to that information and even interactions between patient and clinician. And people often think of HIPAA as kind of a law that primarily regulates our data, but it doesn't. Not really, anyway. HIPAA actually regulates very specific entities by limiting access to patient data to professionals participating in patients' care and to entities paying for healthcare services. So think, your PCP or your health insurance plan. Um, but as we can see, more and more players are gaining access and are working around HIPAA. And it's worth remembering that HIPAA was written back in 1996 when EHR was not widely used and medical records were primarily paper documents, physical documents. And so this then brings me to some of the bias concerns uh, in the adoption of AI as well. I want to start by saying that I define bias kind of very broadly. When I say bias, I don't just mean technical bias, as in, bias that may result from faulty algorithms or discriminatory AI outputs. I also mean structural and systemic bias that result from hospitals and health systems' history of exclusion, oftentimes negatively affecting those who are already marginalized, like minorities, low income, and disabled patients. But also biases that take the form of how and when the technology is used too. Um, this is important because, yes, there are certainly bias issues that can arise from AI adoption, but there are countless studies also showing that healthcare AI mostly relies on data that underrepresents minorities and low-income patients or reflects past discriminatory treatment. What comes to mind for me is even more traditional algorithms like race-based EGFR tests that use a black race coefficient to artificially inflate scores for black patients, which delay kidney transplants for black patients. And then even medical devices. Pulse oximeters, for example, they have been found to inaccurately estimate black blood oxygen levels in black patients. And so these aren't even, AI-enabled devices. These are just very traditional formulas and medical devices used by health systems. Um, and so the AI adoption amplifies these discriminatory practices by automating them, but also scaling them too. So instead of maybe a handful of clinicians who may have their own biases, now entire health systems can perpetuate bias if they rely on AI without critical examination. Um, this can happen because of a phenomenon known as automation bias. Um, there's a tendency for clinicians nowadays to kind of over rely on or uncritically accept suggestions from AI, or clinical decision support systems. And so this can lead to potential harms to patients because now clinicians are kind of sometimes blindly trusting the outputs from an AI model rather than relying on their own expertise or their own training. This also has resulted in experts calling AI systems a bit of an accountability sink, where AI is kind of used as a way to obfuscate accountability. Providers can not sufficiently, appraise or object to AI determinations, and so all of a sudden, AI can kind of break that link between decision makers and individuals. Health insurance is an example that comes to mind for me. Faulty AI algorithms have been found to, cut treatment short for patients or deny treatment. Um, deny treatment without providing, an explanation to patients. And in some cases, AI systems developed by health insurance companies are also used to determine how sick patients are to quote unquote like risk adjust reimbursement to clinicians and health systems as well. Um, and so this absolves someone of responsibility ultimately. And that's the concern with this sort of widespread and uncritical adoption of AI is if a patient is misdiagnosed by an AI model or a certain treatment option is rejected by an AI model, um, that model is sort of taking the blame for that decision rather than a clinician or a health system. So again, this creates a situation where patients have kind of less of a view into that decision-making process, and that also negatively affects clinicians who don't have a way of questioning necessarily why a system has made that decision. So far, I've been very critical of big tech and corporations, but they're not the only ones interested in health data. The state is as well. I won't go into too much of that right now unless we want to discuss it during sort of the Q&A portion. But the government is extremely interested in health data as well. We're seeing that now, even more so in the current political climate. The addition of healthcare data also allows big tech and the state to more efficiently identify and prosecute people seeking things like reproductive health services, abortion, or gender affirming care. Those are really essential healthcare services that are being targeted now more than ever. And so that's another way that sort of the protection of that data is becoming increasingly important and sensitive. I'm sure, as some of you know, earlier this month, two of the biggest players in AI, OpenAI and Anthropic, they launched their own healthcare AI products. And so OpenAI, they actually rolled out two, I would consider two, ChatGPT Health, which is a new feature in ChatGPT. That's something that you actually have to sign up to be on a wait list for in order to get access to. And that's meant to be a service where patients can, upload and provide their own medical records. And ChatGPT Health claims that they'll be able to provide sort of more curated answers to medical questions, things like that. And then there's OpenAI for healthcare, which is it's more of an enterprise focused suite of tools meant for hospitals and health systems. Anthropic launched its own version and announced it shortly thereafter. It's also meant to be used by hospitals and healthcare systems. And so again, we're seeing, in the same ways that, Apple, Google, these, sort of more quote unquote legacy, I think, tech companies are trying to get access to that data and have ultimately succeeded. Now we're seeing the same kind of trend with AI as well. They're um, I think the desire to create a very specific product for healthcare really signals that there is this desire for people to very openly share sensitive information with ChatGPT and Claude and things like that. And so data is obviously an extremely important part of healthcare, and um, that's not to say that data is not valuable, right? I think data has always been a crucial part of the provision of healthcare, but we need to maybe think a bit differently about how we're handling that data, who we're giving it to, and what corporations and for-profit actors want to do with that data and why they want that data. And I'll close with this. Even without the involvement necessarily or intervention of large tech companies to actively gain access to this information, um, everyday consumers are actively engaging with these products and giving over information and using these products to get answers on their own very specific healthcare needs and asking for information and defining terms, things like that. Um, and some of these trends, clinicians, I'm sure, have encountered before, right? With individuals who have Googled symptoms and, rely on WebMD as a way to sort of question doctors on why maybe a certain diagnostic isn't consistent with someone's own beliefs and the own research that they might have done. Um, and this kind of further complicates that because um, now when interacting with an AI chatbot like OpenAI and ChatGPT, um, there's sort of a more personalized element of that, of you giving that information over. And we don't have as much of a view into how the information is being stored by these companies either. But it's worth thinking about how consumers are sort of very openly and freely engaging with this as well, and what that means from sort of a regulatory standpoint, and what we need to be thinking about from sort of how to educate users on what is safe to divulge and what is not. But I'll leave it there. I covered quite a bit, but I want to kind of provide a kind of an overview of my own background and also things that I'm thinking about to kind of color the conversation that we can have. But I really want this to be like an open discussion, and so would love to go through Q&A and talk more about these important issues.
All right. Thank you so much, Patrick. I'm going to stop the recording here so we can have a more open discussion.